The artificial pancreas, the technology, significance, and life-changing potential of automated diabetic management. This presentation will cover what is an artificial pancreas, a brief history, relevant IT components, healthcare uses and implications, relevant benefits, costs, and risks, future trends, and conclusion. What is an artificial pancreas? An artificial pancreas is a closed-loop feedback system used by individuals with type 1 diabetes to maintain his or her optimal blood glucose levels. Individuals with type 1 diabetes cannot produce enough basal insulin, so the artificial pancreas performs this for them. The system is comprised of three main elements: a glucose monitoring sensor, which measures blood glucose levels at predefined set intervals, a control algorithm device, which uses the aforementioned glucose measurements and a set point to calculate the correct dosage or withholding of insulin, and an insulin pump that delivers the prescribed amount of insulin to the wearer. The evolution of the artificial pancreas. Not long ago, the bionic pancreas was just a concept. During the early years, the first artificial pancreases were huge units that were available for clinical bedside use only, like the 1976 Biostarter pictured here. Dean Kamen, inventor of the insulin pump, is also pictured wearing the first portable insulin pump, quite a load to carry. Today, these pumps are no bigger than a smartphone or beeper. Let's review some of the notable points along the evolutionary path of the artificial pancreas. The artificial pancreas concept was first demonstrated by Dr. McCullough of the Cleveland Clinic in 1959. In 1974, the first clinical bedside artificial pancreas was used successfully. In 1982, the first wearable AP prototype was developed. Type 1 diabetes management research began to receive more momentum and funding thanks to the JDRF-established Artificial Pancreas Project in the early 2000s. Before long, hospital trials of closed-loop systems ramped up, and in 2014, home-based studies were completed for wearable AP units. Most recently, in 2016, the FDA approved the first automated insulin delivery device for type 1 diabetes. Some say that this advancement in automated diabetic maintenance may possibly be the most revolutionary for diabetes since the discovery of insulin.
Now that we have learned about a brief history of the artificial pancreas, we can move on to the relevant IT components of the artificial pancreas. As you can see in the picture, the functioning of the artificial pancreas can be divided into four parts. Number one is the continuous glucose monitor that includes a sensor that is placed on the patient's skin to monitor patient's blood glucose levels. Number two is the computer control algorithm behind the artificial pancreas that determines the required doses of insulin. Number three is the insulin pump that supplies the required insulin doses to the patient's body. And finally, number four is the effect of the artificial pancreas on the patient. Now we will examine each of these components in detail. Continuous glucose monitor. As mentioned earlier, a sensor is placed on the patient's skin to measure glucose in the fluid surrounding the cells associated with the blood glucose levels. The continuous glucose monitor shown in the picture on the top right-hand side provides a steady stream of information to reflect the patient's blood glucose levels. A small transmitter then sends the information to the receiver. Currently, patients also need to calibrate the continuous glucose monitor using a blood glucose device to get the most accurate readings as shown in the picture on the bottom right-hand side. Now we will talk about the closed-loop algorithm system behind the artificial pancreas. The computer control algorithm for the artificial pancreas works on a closed-loop system. A closed-loop system is a control system where the output of the system is monitored and fed back into the system as an input to the system. A control algorithm is the software that is embedded in an external processor, which is also called the controller. The controller in this case can be embedded in an insulin pump or a computer or a mobile device. The controller receives information from the continuous glucose monitor and performs a series of mathematical calculations. Based on that, it then sends the dosing instructions to the insulin pump. The picture on the right-hand side shows how the closed-loop control system algorithm works. The first option that must be specified is the desired blood glucose. This can either be a specific value or a zone, and it can be fixed or time varying. The controller receives the measured blood glucose and compares it to the desired concentration. The tuning of the control algorithm determines how aggressively it will react to blood glucose deviations from the desired value. The control algorithm then generates an output for insulin delivery, and the controller output is calculated at discrete times as determined by the controller action interval. The signal is then communicated to the pump, which may be subcutaneous or intraperitoneal. The glucose concentration is measured by one or more glucose sensors at a specified time interval. The sensor signals are processed by filters or fault detection algorithms before being communicated to the controller, and then the entire process is repeated at the next sample time. Next, we talk about the insulin pump. The insulin pump adjusts the insulin delivery to the tissue under the skin. It uses the instructions provided by the controller to supply the required insulin doses to the patient. Finally, the patient effect. How patients react to the artificial pancreas is very important. As their blood glucose levels are constantly changing due to reasons such as their diet, activity level, and metabolism, the artificial pancreas reduces the stress that comes with having to continuously monitor and worry about blood glucose levels and insulin dosage.
Now that we've learned a little bit more about the artificial pancreas and the algorithm technology behind the closed-loop system, I'd like to talk a little bit more about the effects and implications that this has on the healthcare industry and the diabetic community. When we look at how this technology is impacting the lives of diabetics, there are three main themes that are prevalent. 1. Higher accuracy for measuring and managing glucose levels in type 1 diabetics. 2. Reduction in health complications that may arise from poorly managed diabetes. And 3. Improved quality of life for children and adults with type 1 diabetes. Let's take a closer look at these 3 points. Higher accuracy for measuring and managing glucose levels using the artificial pancreas. It's estimated that nearly 70 to 80% of diabetic patients are not within their target glucose range, despite their efforts to properly manage the disease using blood sugar testing kits and insulin doses administered with a syringe. The chart below is an example of a typical diabetic's 11-day glucose readings. The area in green is the target range. The bottom half of the chart is monitoring the glucose levels at night when a patient has less control over their blood sugar. You will notice that in both the day and the nighttime, the blood sugar levels are very inconsistent and they rise and fall, with larger variances occurring at night. Now this is a chart of the same patient who started using the artificial pancreas for treatment. You can see that the patient is now within target range every day, with very few drops or spikes and a much flatter line for the nighttime readings. The artificial pancreas has the ability to monitor and maintain blood glucose levels better than a human can. This on its own is a huge game changer with anyone who has type 1 diabetes. We must also consider the impact this has for physicians and nurses who will be caring for diabetics. With their diabetes being monitored and controlled with the artificial pancreas, They can spend less time trying to control the patient's blood sugar levels and focus on more pressing medical conditions. They will also be able to offer more consistent care for patients who may be in a long-term care facility who are unable to administer their own insulin. So with the artificial pancreas and these higher accuracy readings and less spikes in blood glucose levels, the body is also at a reduced risk for other complications that are commonly associated with diabetes. The chart below shows the most common complications that can arise for those that have poorly managed diabetes. Things like a stroke, heart attack, or kidney damage can be long-term medical conditions that are costly for the patient and the healthcare industry. Although these complications are always more susceptible in diabetic patients, consistent glucose levels can drastically reduce the risk of these life-threatening medical conditions. When we really think about the overall impact of harm reduction from the artificial pancreas, the obvious point is that people are healthier and less at risk. It is also saving the healthcare industry and taxpayers money. In a study completed by the American Diabetes Association in 2013, they concluded that diabetes cost the U.S. $245 billion in healthcare costs and lost productivity in the year 2012. If the use of the artificial pancreas decreases these costs by only 20%, as a country, we would save over $49 billion. If you sit down and talk to anyone who has diabetes, or is the parent of a child with diabetes, you will learn that their lives are more complicated than that of the average healthy individual. Every day they have to worry about checking their blood sugar levels. They have to be mindful of what they eat and make sure that they eat at a consistent time every day. They know that if they want to go to the beach or do some yard work, they need to pack a snack and a sugary drink in case they have a low blood sugar crash. The artificial pancreas improves their quality of life because they are less worried about making sure that they stay within their target levels of insulin. Parents of children with type 1 diabetes are now able to feel more comfortable letting their child go to a sleepover. Adults and the elderly are able to continue to live more independently. The improved quality of life is invaluable to anybody who suffers from this disease. Stress and burden of having to remember to check blood sugars is eliminated. Sleep loss and insomnia from spikes at night is also eliminated. And they get the benefit of having greater flexibility in their eating schedule and food choices, and greater opportunity to exercise and enjoy leisure activities.
Okay, now I'm going to talk about the relevant costs, benefits, and risks of the artificial pancreas. How much does an artificial pancreas cost? Type 1 diabetes is unfortunately an expensive disease to manage. The regular monthly expenses for someone living with this chronic condition, just to manage their symptoms alone, can be well over $1,000. An artificial pancreas will cost the patient between $5,000 and $8,000. The annual cost of the disposable sensors will add another few $1,000s. However, this may still make the artificial pancreas less of a financial burden compared to other methods of managing symptoms. Professor Richard Bergensdale from the International Diabetes Center believes that within the next 5 years, with health insurance and reimbursement permitting, the majority of people suffering from type 1 diabetes could be using an artificial pancreas. This picture shows the monthly cost for someone living with type 1 diabetes after their insurance. Notice how some of these items cost over $400. That's a lot of money. So what are the benefits of the artificial pancreas? The artificial pancreas is able to provide people affected by type 1 diabetes with a better quality of life in numerous ways. Glucose levels will be maintained automatically, allowing for days filled with less worry and peaceful nights. A regular insulin pump delivers only a small amount of fast-acting insulin continuously throughout the day. However, patients must test their own levels. The artificial pancreas automatically adjusts for these levels. It does not rely entirely on user input, which eliminates a lot of errors. Although patients may have been entirely committed to their previous treatment methods, the results may have not been what they had hoped for. The artificial pancreas helps achieve optimal results with significantly less of a burden for the user. This picture shows what the artificial pancreas would look like on a patient. So now you know the benefits. Now what are the risks associated with the use of an artificial pancreas? Optimal function of the artificial pancreas is critical to ensure the safety and health of the user. Although this wearable technology has improved the lives of many people with type 1 diabetes, there are a few risks that must be addressed. Number 1, software integrity and the risk of viruses, worms, spyware, access to personal information, or device manipulation. Number 2, external concerns include exposure to electromagnetic fields that could interfere with proper function of the system. Number 3, the current device cannot be used by children aged 6 years or younger or by patients who require fewer than 8 units of insulin per day. Number 4, skin irritation or redness around the device's infusion patch may occur. Now let's talk about future trends. The artificial pancreas is soon to become the most revolutionary advancement in diabetic care since the development of insulin back in 1922. According to JDRF, as these wearable technologies continue to advance, they are becoming better at predicting blood sugar changes and providing controlled insulin dosing that will soon be able to virtually eliminate hyperglycemic and hypoglycemic episodes. Today, the artificial pancreas systems that both monitor blood glucose and automatically suspend insulin delivery in order to prevent dangerously low blood sugar are both on the market. Currently, with these devices, the patient sometimes must input information regarding their activity level into a device that is connected to a glucose sensor and insulin pump that will then run artificial pancreas algorithms based on the patient's needs. This device will then deliver the appropriate amount of insulin as needed. Although the user does not have to worry as much about their insulin levels as opposed to alternative monitoring methods, they do have to periodically feed the device information. The ultimate goal of the artificial pancreas is that it will eventually be able to predict all of these levels for the user. This will allow the patient to not have to input any data into the device. Researchers are pushing for faster acting insulin and improved sensing technology. The next generation of these systems are expected to provide better outcomes and be even less of a burden. So in conclusion, wearable medical devices implement groundbreaking technology that improve accuracy, connectivity, and performance to provide patients with the absolute best care possible. The artificial pancreas is an example of a major breakthrough in wearable technology that is truly transforming the way patients are cared for and improving the lives of people who have type 1 diabetes. We chose to discuss the topic of wearable technology simply because it is the future of healthcare and has already been able to change the lives of many people affected by this chronic condition.
As we've learned here, the artificial pancreas is a wearable technology that is developed quickly and is changing people's lives. We can definitely expect further advancements in this field to improve patient quality of life and reduce medical emergencies. Thank you for listening.